Thank you for your interest in our research study titled Delphi Survey to Identify a Core Outcome Set in Non-Surgical Endodontic Treatment, Retreatment, Surgical Endodontics, Epexification, Vital Pulp Therapy, and Regenerative Endodontic Therapy. This project is led by investigators from Canada, the United States, and the United Kingdom, and is supported by a grant from the American Association of Endodontists and the Foundation for Endodontics. Core outcome sets represent the minimum effects of treatment, also known as outcomes, that should be measured and reported in all clinical trials of a specific condition. Currently, there is no core outcome set for studies related to endodontic treatments, which may hinder the comparison of the effectiveness of interventions across trials. This study seeks to establish a core outcome set related to non-surgical endodontic treatment and retreatment, surgical endodontics, vital pulp therapy, epexification, and regenerative endodontic therapy. Outcomes that will be included in this core outcome set would be reported as a minimum in all endodontic studies. This will standardize outcomes reporting across future trials, enhance evidence synthesis on the best interventions for endodontic treatments, and support evidence-based decisions for patient care. When designing this research study, we plan to include patients with personal experience undergoing one of the investigated treatments, clinicians with expertise in providing any of the investigated treatments, and researchers and academicians conducting studies on interventions related to any of the investigated treatments. This study involves 2 rounds of online surveys. In round 1, you will be asked to assess the importance of treatment outcomes related to non-surgical endodontic treatment and retreatment, surgical endodontics, vital pulp therapy, epexification, and regenerative endodontic therapy. We will provide descriptions and informative videos about these treatments, and we will also provide plain English descriptions for each outcome. You will have the option to share any additional treatment outcomes that you believe are important and may be missing from our list. In round 2, you will be presented with the ratings results of the different groups of participants, and then will be asked to reevaluate your ratings. Also, we will ask you to rate your perceived importance of the newly proposed outcomes from round 1. Following the surveys, we will hold a virtual consensus meeting to finalize the core outcome set. Thank you so much for listening.